Half of all women over 65 experience noticeable hair thinning. You find more hair on your pillow, more hair in the drain. Your ponytail is half the thickness it was 10 years ago. You can see your scalp through your part line. And when you mention it to your doctor, they say it is just aging. That answer is not good enough, because in many cases the cause is treatable. Low iron, low thyroid, low vitamin D, a medication side effect, even chronic stress. Your hair is not just falling out for no reason. Something is causing it, and nobody has taken the time to figure out what. I'm Dr. Rosalind Keller, 36 years in family medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. You are standing at the bathroom mirror after your shower. You run your fingers through your hair, and a clump comes away in your hand. More than usual. You stare at it. You look at the drain. There is a nest of hair sitting on the drain cover. You look at your reflection and tilt your head. Your part looks wider than it did a year ago. You can see more scalp than you used to. You open a photo on your phone from 3 years ago and compare. The difference is obvious. You feel a wave of something between sadness and fear. You have always taken care of your hair. You eat well. You do not dye it with harsh chemicals. Why is this happening? You search online and find 400 products promising thicker hair, all of them expensive, and none of them explaining what is actually going wrong. I have seen this in hundreds of patients. The myth I need to correct is that hair thinning after 65 is purely genetic, and there is nothing you can do. While genetics play a role, in my experience, at least half of the women I saw with hair thinning had a contributing factor that was correctable. The most common treatable causes are low ferritin, stored iron, low thyroid function, low vitamin D, medication side effects, and chronic telogen effluvium from prolonged stress or illness. None of these show up unless someone orders the right blood tests, and most annual checkups do not include them. Here is how hair growth works. Every hair on your head goes through a cycle. The growth phase lasts 2 to 7 years. During this phase, the hair follicle is actively producing a strand. The resting phase lasts 2 to 3 months. During this phase, the hair sits still. Then the shedding phase. The old hair falls out and a new one starts growing. On a healthy scalp, 85 to 90% of your hairs are in the growth phase at any time. Only 10 to 15% are resting or shedding. After menopause, 2 things change. First, the growth phase gets shorter. Hairs that used to grow for 5 years now grow for 2 or 3. They are shorter and finer when they shed. Second, the follicles themselves miniaturize. They physically shrink. The hairs they produce are thinner and less pigmented. Over years, thick hairs are replaced by wispy, nearly invisible ones. The follicles are still alive. They are just producing less. That is why treatment can work. The factory is still running. It just needs the right fuel. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. I want to tell you about Diane. Diane was 68 years old, retired high school counselor from Raleigh, North Carolina. Diane noticed her hair thinning at 63 after a stressful year caring for her mother who was in hospice. She assumed the stress caused it and the hair would come back. It did not. By 68, her part was visibly wide. She could see her scalp in photographs. She wore hats constantly. She stopped going to her salon because the stylist kept suggesting products, and Diane felt ashamed. Her doctor at a routine visit ordered a standard blood panel. Everything came back normal, but Diane pushed. She asked me to check her ferritin. It was 18. Normal range starts at 12, but hair specialists say ferritin needs to be above 50 for optimal hair growth. Diane's iron stores were technically normal, but far too low for her hair. We also checked her vitamin D. It was 22, below the 30 threshold. And her thyroid antibodies were mildly elevated, suggesting early autoimmune thyroiditis that her standard TSH test had not caught. Diane had 3 correctable problems, and none of them had been found because nobody ordered the right tests. Here is your first test, the pull test. Wash your hair normally and let it dry. Take a small section of about 60 hairs between your thumb and forefinger, close to the scalp. Gently but firmly pull from root to tip. Count the hairs that come out. Repeat in 3 different areas, the top of your head, the side, and the back. If you pull out more than 6 hairs in any section, you have active shedding beyond normal. If the number is consistent across all 3 areas, the shedding is diffuse. If one area sheds more than others, it may indicate a localized cause. Here is your second test, the part width comparison. Take a photo of your hair part from above using your phone. The best way is to stand under a bright light and have someone photograph the top of your head, or use your front-facing camera angled above you. Compare this photo to one from 1 to 2 years ago. If the part has widened noticeably, the white line of scalp is broader. That confirms progressive thinning. Save this photo. Take a new one every 3 months. This is how you and your doctor will track whether treatment is working. Things that accelerate hair thinning after 65. First, crash dieting or rapid weight loss. Losing more than 15 pounds in 3 months can trigger a massive shedding event called telogen effluvium. The hair goes into shock and pushes 30 to 50% of follicles into the shedding phase simultaneously. Second, iron deficiency that looks normal on standard tests. Standard labs flag ferritin below 12 as low, but hair researchers consistently find that ferritin needs to be above 50 for healthy hair growth. Many women with thinning hair have ferritin between 15 and 40, technically normal, functionally inadequate. Third, proton pump inhibitors. PPIs reduce absorption of iron, zinc, and B12, all nutrients your hair needs. Fourth, tight hairstyles. Consistent tension from tight ponytails, braids, or clips causes traction alopecia, a mechanical pulling that damages follicles over time. Here is what supports hair regrowth. First, iron-rich foods if your ferritin is below 50. Red meat twice a week, spinach, lentils, and fortified cereals. Pair iron-rich foods with vitamin C, such as orange juice or bell peppers, to improve absorption. Second, eggs. 2 eggs per day provide biotin, protein, and zinc, 3 of the essential building blocks for hair. 3. Pumpkin seeds. A handful daily provides zinc, iron, and omega-3 fatty acids. A 2014 study found that pumpkin seed oil supplementation increased hair count by 40% over 24 weeks. 4. Sardines or salmon twice a week. The omega-3 fatty acids reduce scalp inflammation that contributes to follicle miniaturization. This is the Keller Hair Recovery Protocol. Step 1. Ask your doctor to check ferritin, vitamin D, TSH, free T4, thyroid antibodies, and zinc at your next blood draw. Do not accept your blood work is normal without seeing the ferritin number yourself. If it is below 50, you need supplementation, even if the lab says it is in range. Step 2. Eat 2 eggs, a handful of pumpkin seeds, and 1 serving of fatty fish daily. This covers the protein, biotin, zinc, iron, and omega-3 your follicles need. Total cost, about $4 per day. Step 3. Apply 2% minoxidil to your scalp once daily. This is available over the counter at any pharmacy for about $20 per month. It is FDA approved for female pattern hair loss. Apply it to dry hair at bedtime. Results take 3 to 6 months to become visible. Take a part-width photo every 3 months to track progress. Diane supplemented iron to bring her ferritin above 60. She took vitamin D to reach 50. Her doctor started her on a low-dose thyroid medication. She applied minoxidil nightly. At 4 months, new baby hairs appeared along her part line. At 8 months, her stylist noticed the difference without being told. At 12 months, Diane stopped wearing hats. She told me the blood tests cost less than 2 months of the expensive hair products she had been buying that did nothing. She said she wished someone had checked her ferritin 5 years ago. Write your age below, and tell me, how long have you been watching your hair thin without understanding why? I read every comment. Here are your 5 takeaways. 1. Half of women over 65 have treatable contributing factors to hair thinning. 2. Get ferritin, vitamin D, thyroid antibodies, and zinc tested. 3. Ferritin needs to be above 50 for hair health, not just above 12. 4. Eggs, pumpkin seeds, and fatty fish are the cheapest hair recovery foods. 5. Over-the-counter 2% minoxidil is FDA approved and costs $20 a month. This is the conversation your appointment never had time for. The question you wrote down and then crossed out in the waiting room. I don't sell anything. I don't have a practice. I profit from you not needing me. You deserve answers without embarrassment. I'll see you in the next one.